Well, tonight, the nation is adjusting to some game-changing guidance from the CDC, and we're talking about big steps back to normal. The CDC now says people who are fully vaccinated against COVID-19 do not have to wear masks in most situations.
They're still required on public transit as well as in hospitals and in schools. Businesses can determine whether customers will still have to wear masks.
Governor Kate Brown tweeted today, until we have vaccination verification guidance and procedures in place, businesses should continue following current guidance. But that wasn't exactly the message from the Oregon Health Authority this morning.
Fox 12's Brenna Kelly spoke to the state epidemiologist, Dr. Dean Seidlinger, to get some answers. Brenna?
Good evening, Pete. Many of you have questions, and we have questions too. Seidlinger said today the new CDC guidance, quote, does nothing to weaken the protection we have to decrease the spread of the virus. He's talking about all of the tools we have now to protect us. If you choose not to get a vaccine, you will still need to mask up and distance. So what are we waiting for exactly from state officials? As a reminder, yesterday, Governor Kate Brown said she's adopting CDC guidelines, but now it's up to states and local governments to roll this out logistically. The Oregon Health Authority is going to provide guidance to businesses soon, but Seidlinger would not definitively say when. So the first question here is Oregon still under the state's county risk level framework? The answer is yes. However, I'll give you an example of what could change. If a restaurant in high risk, which means 25% capacity inside, chooses to verify vaccination status and allow fully vaccinated customers to remove masks and move closer together, they may be able to fit more diners than their space allows right now. Another point, Seidlinger says they do not want businesses to choose only to serve vaccinated people and exclude service for others. Now, here's another question. How will businesses verify vaccination status? Will they have to be the vaccine police? Seidlinger says businesses have a choice. They can choose to stay under current guidance, of course. If a business chooses to adopt the new guidelines, however, Seidlinger says he understands it puts them in a difficult position, but they want business owners to have a system in place to ask about vaccine status and verify it. Businesses are already generally required to have someone monitoring social distancing, and Seidlinger says they're hoping those people, for example, can shift their responsibilities. And yes, that will likely mean asking for physical proof to verify.
We would anticipate that an establishment, a business, will have to have a system in place for asking about vaccine status and verifying that. Right now, I would anticipate that would be seeing a card with the individual's name, the vaccines they've gotten and the date and where they've gotten them. That could be a picture of that vaccine card or record from their provider on their phone. But a way of just seeing that does not need to be recorded because we need to know that they're vaccinated so that business knows that their employees and that their other customers are protected.
And you heard him there, it does not need to be recorded. The last question here, will this plan be in violation of HIPAA or privacy rights? Seidlinger says people who do not want to wear masks or distance in a restaurant or store would voluntarily share this information. Otherwise, they will need to wear a mask. Though we do not have OHA's guidelines yet, Seidlinger says they have to work with their regulatory partners like OSHA to make sure they're in alignment. It's not clear what type of enforcement is going to be involved just yet. Reporting live in studio, Brenna Kelly, Fox 12 Oregon.